The U.S. now averages more than 69,000 new coronavirus cases a day. That's an all-time high, and 12,000 Americans have been hospitalized for COVID over the last month, a jump of nearly 40%. This morning, we hear from 3 doctors who say hospitals are close to their breaking point. Our lead national correspondent, David Begnaud, has our report.
The situation in Utah's hospitals is increasingly dire. Experts are warning that doctors may soon need to confront the unthinkable, rationing healthcare as beds fill up and staff are stretched thin. Dr. Eddie Stenium is an infectious disease physician there.
At this point, there's really no end in sight for us. Our case counts are continuing to rise. Our hospitalizations are continuing to rise. So there's no rounding the curve for us here in Utah.
The possibility of having to ration care is also becoming a concern in parts of Idaho, where COVID hospitalizations have more than doubled since the beginning of October. At St. Luke's Magic Valley, Dr. Joshua Kern says roughly 30% of the hospital's 150 patients are infected with coronavirus.
It's totally unprecedented. Even during bad influenza seasons, it's not like we see, a third of the patients in the hospital with influenza. It's teetering on the brink, right? We're right there. We need to turn things around or we're going to be in big trouble.
To Wisconsin now. Dr. Jeff Potoff at University Hospital in Madison says 4 of his hospital's COVID wings are full. So they're opening another converted wing this week.
It's never been worse for us here in Wisconsin, and every day it's not getting better. It's getting a little bit worse. The ice is so thin right now as we try to do everything we can, get as creative as we can to take care of all the patients that need our services.
All 3 of these doctors agree there is no end in sight for the pandemic. For CBS This Morning, I'm David Begnaud in New York.
So it continues.